So this spring makes a bit of room so those teeth can be pushed back a little bit. So when you get home, I'd recommend that you take some Panadol normally. Some people find a bit of tenderness or pain, some people don't. But just to be sure, just take some Panadol and then repeat in about 4 hours' time.
Yeah.
The first 2 to 3 days, everyone gets a little bit of discomfort. It's like having a new pair of shoes and you've got to wear them in before they become a bit more comfortable. With food, you're not really going to want to chew anything hard, sticky or chewy, especially for the first couple of days. So something you can squash with your tongue and swallow. So pasta, spaghetti, risotto, noodles, soup, yogurt, they're really good foods to have. What do you think of those foods? That'll be okay?
Awesome. I always eat pasta, so no change there.
Fantastic. With food in general, if you can't cut it with a knife and a fork, don't eat it. So don't eat nuts, ice, pork crackle, minties, redskins, toffees, dollies, common sense. That applies for the life of the braces. With drinks, if it's not milk or water, don't drink it. Do you drink water anyway, or do you drink much juice?
Water, milk, orange juice as well, so that won't be...
Yeah, it's a good question. Orange juice is fine, just don't do too much of it, and probably avoid the soft drinks. Once in a while is okay, but just not too much.
So anything acidic?
Yes,
I should be avoiding.
Definitely anything sugary and acidic, don't have it at all.
Okay.
Now, we'll go through the brushing. You're brushing in the morning, before bed, and after every meal. With the brushing, make sure that you brush your teeth front to back as you normally would. Angle the toothbrush at 45 degrees so you can feel the gums being rubbed. If you can't feel the gums being rubbed, it's a waste of time. Make sure it's getting in between. You can see it's getting in between. Once you've done the gums, come around and do the tops of the teeth again. So I'll show you again. Doing the front, the gums, getting in between. Make sure you can feel the gums being rubbed. The tops of the teeth again. Don't forget to brush the insides of your teeth as you normally would. Electric or manual toothbrush is fine, whatever you prefer. Go to the pharmacy, you can get whatever you like, mouth rinse, floss. There's no rules on the brushing as long as you're doing enough of it. Have a close look at your teeth and just make sure there's nothing stuck on them. Clean teeth move better, they're healthier, and it's just all around a lot better.
Awesome. Okay. Also, that does raise a question. So, I've been told about tooth mousse.
Yeah, you can use tooth mousse, it won't harm at all. So after your brushing, pop some on and just go to bed. It's fine.
Okay, sweet.
The last thing is the wax. You might have some sharp bits on the braces, some catchy wire, or sometimes loose braces as well. The wax fixes most of these problems. Take the wax and pinch a little bit off, like a bit of blue tack. Roll it thin between your fingers and stick it on wherever you need to. Whether it's the front, the back, or the side, the wax makes things smooth, gets rid of sharp bits, and just all around adds to comfort. Use as much or as little as you need. It'll be your best friend for the first couple of weeks. You can also pop Bonjela if you have any ulcers in the short term.
Awesome. And if like you said, loose braces or something, should I be ringing up?
Give us a call and we're more than happy to take a look anytime, but it's entirely up to you. Okay. Most things can usually wait until your next appointment, but give us a call if you're not sure.
Awesome.
Cool. So just to re-summarise, just the food, if you can't cut it with a knife and a fork, don't eat it. The wax fixes most problems. And you're brushing in the morning, before bed, and after every meal. We'll be seeing you every 6 weeks, every 8 weeks, and you'll find the teeth move fairly quickly.
Awesome, I can't wait.
Any other questions?
I think that's it.
All right, fantastic.
Thank you very much.
And it's as easy as that. Getting your braces on is